Renza, welcome to the dialogue.
Hello. Hi. Thank you so much for inviting me to have a chat.
I'm really excited to chat to you. Actually, there's so much to cover, and I'm glad we finally kind of got here after 15 minutes of technological issues. And I already commented on your backdrop, but great backdrop.
Thanks. Thank you.
Amazing.
Yes. Well, yeah. We can't find anything on our bookshelf, but hey, it looks great in Zoom. So
very appropriate for the day and age.
It is, and I usually take them down. There are a couple of books up there, and you're not going to be able to see them, so it's okay. But they're quite sweary on the front covers. They should not.
I don't see any
Playboys
Playboys or penthouses, so you're good.
No. There's nothing. There's no nudeness, but there is certainly a few F-bombs. Nudeness, which is why you make young words.
I want to read those books.
They're fun.
Thanks for joining us. So do you want to maybe just start from the beginning? Give us your own sort of bio.
Okay. Well, I guess I'm here to talk about diabetes. So let's talk about that to start with. So
good idea.
I was diagnosed with type 1 diabetes in April 1998. So I'm 22 and a half years into this diabetes palaver. My diabetes management these days looks very different today to how it looked back 22 and a half years ago. I'm using a DIY loop system now, which I quite frankly adore. And I've been using.
We could do a whole episode on that, actually. Maybe we will. Like the whole loop thing. I'd love to talk about that someday because I don't even understand it that well. But keep going.
Yeah. So that's what I've been doing for the last 3 years, and honestly, it completely has, revolutionized the way I'm a looper. But it's also completely I feel like in the last 3 years, diabetes has been the least burdensome than ever in the whole time I've lived with diabetes.
Because of looping?
So, say again?
Because of the looping?
Because of the looping, yeah. The looping has just, it has taken away so much of what I have to do day to day with diabetes management. It's far smarter than me. That's basically, the bottom line behind it is that all the diabetes crap that you ever have to deal with is so frequently because of user error, and it's just because we're not a pancreas. That's the bottom line. But hey, this algorithm is way smarter than I could ever be.
I did have that kind of realization recently, where I was like, our brains as an organ are essentially trying to do the job of a pancreas.
Exactly. And a pancreas has lots of jobs, but the bit that, focuses on keeping your glucose levels stable, that's what it does. It does that. We have a million other things to do. So diabetes is absolutely never the most important thing in my life. And now I can park a lot of the stuff that I used to have to do because Luke does it.
That's really interesting, actually. I just want to kind of ask about that because it's actually a topic that I'm particularly interested in, and that is and the reason I'm interested in it because I'm obviously in the community now, and one of my kind of bugbears is a little bit of seeing people in the community who are woe is me, who spend a little bit too much time on feeling sorry for themselves. And don't get me wrong, there's no shortage of suffering happening in the diabetes space, and there's no shortage of people with complications, and I get that, but there's also, I think, an opportunity for some people to maybe try and adjust their perspective a bit. And your perspective sounds like you've got a little bit. You seem like you're well adjusted in terms of where, given how embedded you are in the community, but how well you tend to process diabetes and the role that it plays in your life. And it sounds like you don't let it necessarily be, taking over too much.
Wait, so I will answer and address that, but firstly, I'm just going to work out how to get a little grab of you saying you seem well adjusted, and I'm just going to hand that out to people when I'm flying off the handle about anything.
I don't know you well enough. You don't seem like a handle flying off type person, but good to know.
Really am. Oh my god, might get a little spring over that too. No,
you can teach me how to. You can teach me how to fly off the handle better.
My family's Italian. We are very good at flying off handles. Anyway, with
but I think Italians get away with it somehow. Actually, there's something about an Italian leaning out the car window and telling you they're going to kill you Like, I feel like
We
I'm
don't mean it. We
in the
never mean
country,
it.
and I'm like, oh, thank you. Whereas in Australia, when someone does that, I feel genuinely threatened.
Yeah, no, we don't really mean it. But to your point, oh my goodness, no. There are days where I do feel very woe is me. But it's really interesting. I feel sometimes though that the stories that we so often hear are people who are doing truly remarkable things. You know, people with diabetes who are climbing Mount Everest and who are
Yeah,
running marathons.
yeah.
And oh my gosh, they are amazing. But I kind of want to hear more about the day-to-day people who, you know, I mean, I go hypo when I take the dog for a walk. So the idea, I mean, and I also have a moral sort of objection to exercise. So I'm never going to run a marathon.
A
But
moral objection to
yeah, yeah,
exercise.
yeah, yeah. But you know, I mean, I think keeping it real is totally important. But equally, I do think that there's like a point where, you know, if you are feeling so consumed by diabetes being a real struggle, which it absolutely is for a number, like there are a million reasons why that might be the case,
Yeah,
is trying to find a way to actually seek help around that. And again, that's
yep.
very much easier said than done for a lot of people. And also, you know, I do need to, and I think we do need to acknowledge the privilege bubble that we are very happily living in Australia, when we have the NDSS and we have the PBS, and when they're going to be wondering where our next vial of insulin is going to come from. And, you know, so I think that it makes it easier sometimes to feel that we can overcome.
Yeah.
Because we're living in somewhere, and you know, my own personal privilege as well of being able, you know, health literate and being able to access the healthcare I need and afford whatever I need if it's not subsidized and stuff, makes, you know, I'm able to access those tools that make life with diabetes easier.
So I want to go two ways with this, and that is to
Yep.
kind of jump in and understand a little bit about the broader global context, because I know you've got a perspective on that. But let's understand first of all how you have a perspective on that. Like, what is, how do you know so much?
Oh, I don't. It's all blustering and whatnot. So my day job is I work at Diabetes Australia, where I am the manager of type 1 diabetes and communities. And I've been doing that now for just over 4 years. But before that, I was at Diabetes Victoria for 14 years, where I built and then ran a program that was about community and community engagement. So in that program, which is still running at Diabetes Victoria, but there are things like kids camps, events for people living with diabetes, a lot of resource development, a lot of peer support stuff. So through my day job, it was always really important to have a grasp of what's going on in the diabetes community. But fortunately, there are a couple of things that made me, I guess, or really has helped me get to the point where I am now. The CEO of Diabetes Australia used to be the CEO of Diabetes Victoria. So we've worked together for a very long time. And he always had this perspective of, well, we can't only understand and know what's going on within our boundaries. What else is out there? And so that really, and at the same time, I was really interested in reading stories. I've always been interested in reading stories, but I wanted to hear stories of people living with diabetes. And I was starting a blog, and I was starting to write, and I just, you know, I found this global diabetes community that was just remarkable. And that has given me, and you know, now I have friends literally all over the world who are living with diabetes who provide that insight. You know, I understand that if you're living in this country, these are the challenges. If you're living in this country, oh my gosh, they've got it really, really well. They've got it really great there, whatever. So that's kind of, I guess, how. So in probably about the last 5 or 6 or even more now years, part of my job has been to, I guess, you know, there is this very big community of diabetes advocates who come together at diabetes conferences, making sure that what used to really only be available and open to health professionals was accessible to people living with diabetes. Now, not necessarily meaning that every single person could get a registration badge and walk into any diabetes conference. We're not there yet, unfortunately. But it meant that a significant number of us are. Even this year, where we're not traveling, we're virtually there, I guess, and then able to communicate in the language that works for us. So it's not necessarily highly technical. It's breaking it down to, great, that's an awesome study, but how does that translate? What does that mean to people who are actually living with diabetes? What does that look like? And so that's been a big part of my job. So this year's been really interesting for me. I've very much been within the walls of this house, whereas usually I spend probably a week. Last year I was spending a week each month overseas in different, on different advisory boards or at conferences or hosting events. And so that's why I guess I have a global perspective of what's going on.
So what the remit of Diabetes Victoria and Diabetes Australia, are they the same organisation for all intensive purposes, or are they completely different in terms of where they get their funding from and how they go about their business?
We have a federated model, and if you go onto the Diabetes Australia website, that's all very clearly explained in ways far more concise than I am. Diabetes Australia is the national body, and then the state bodies are the ones that actually have members who are people with diabetes. So if you're a member of a diabetes organisation, it is your state-based organisation, not of Diabetes Australia nationally. So my role now at Diabetes Australia is far more around national policy. Diabetes Australia administers the NDSS, which is a federal government initiative. So Diabetes Australia does that, but each of the different state bodies are their own entity. They have their own board. They have their own, they have their own board. But we very much, we are a national body with very aligned, I guess, what we're trying to do, which is to support people living with diabetes.
And where does the money come from?
Oh, again, this is one of those things you need to go and have a look at the website, because all of the information is on there. There is certainly money that comes as administrators of the NDSS. The states will have other funding channels as well, so that's different in each state. And again, they very clearly declare all of that. And of course,
it's public money and private money.
Yeah, that's right. Yep. And the states also, of course, as well, have their membership fees that they collect from people like us living with diabetes. Okay. Yeah.
And hopefully it's not putting you on the spot too much, because it's just a question off the top of my head, but how do we know? How do we know if the money's being spent well?
Yeah, well, absolutely. I mean, that's a good question. Everything is pretty transparent. It really is. There are annual reports that are available. You can see how much money is coming in. You can see how much money is going out. You can see where the money's going. So, it is there. And that includes things like, who are we partnering with and what does that partnership look like? So, conspiracy theorists might suggest that, and this isn't just a diabetes thing, this is a health organisation thing. The Heart Foundation, Kidney Foundation, all of us apparently are in the pocket of big whoever you want to choose for today, because it changes daily. However, you can see very clearly we're not hiding where we have a relationship. It's very transparent, and what that looks like is also transparent. So we love it's always, I kind of feel like there are certain themes that keep coming up, and this is not only related to health organisations, it's also related to advocates being out there, because often our funding comes from the same, our funding might come from a device company or something, and who owns me? Well, absolutely no one. And the companies are very, if I have an arrangement, they know that going in.
Well, it would also be short-sighted and remiss if your job is to go and make the community better or enhance the lives of diabetics in Australia, and you don't have a relationship with companies that are providing the things that also enhance the lives of diabetics, then you're not really doing your job.
I've always felt that the diabetes world is made up of different key players. It's made up of, obviously, people with diabetes who are right at the centre. It's made up of the health professionals that we work with. It's made up of industry. It's made up of government, because regulation comes through government, funding sources come through government, in terms of, access. Diabetes organisations are often the key to all of those, connection to all of those groups. And it's always made far more sense to me that we should all be talking. And I know that I'm frequently unpopular about that view with people within the community who think that it should be a very clean and separate, there should be a very clean and separate divide. But equally, I'm often very, very unpopular with the groups that I am working with, because they know that they're not going to get a sanitized, dishonest comment from me. I'm pretty abrupt. And I was sitting in a advisory board meeting last year. It was the first one I'd been invited. It was with a pharma company, and I was very happy to be there because this was something that was pretty exciting that was going on. Yeah. And the first slide that they showed was a page from my blog where I had torn strips off them because of their advertising at a diabetes conference. I was absolutely horrified with what I saw when I walked into this conference, and there were a lot of F-bombs dropped in that blog post. May have even actually been in the title of that blog post. And I thought, they brought me here to sacrifice me because I dared to speak them. But, it wasn't that. It was very much, okay, so we stuffed up here and we're keen to know how to not do it again. I'm like, you talk to people with diabetes, because if you had shown that to pretty much anyone with diabetes, they would have gone, that's a really bad idea. So,
that's a good example of where relationships with industry are helpful, right? And if we don't have that, if industry doesn't exist, then what do we have? So let's be grateful for what industry bring to us and how they help us improve our lives. And two, if they're doing that and we don't have a relationship with them, then we can't help them do better. So
yeah,
well done.
I don't have this sort of, but there are a lot of other people who are on groups within device companies, and I'm not involved in any of this, mostly because there are no devices that are actually built and made here, but who are part of that process of, okay, how does this device work for you? How does it feel? Is this feature that we as the device company are really excited about? Is that something that people with diabetes are going to be really excited about? I would much prefer that design and that development and all of that stage is absolutely loaded with people with diabetes, rather than there not being that input, and then suddenly we're given something that we all look at and go, well, this is stupid and I'm never going to use it. So I think that there is time, and it is necessary, and there can be partnerships. And if anybody was to read my blog, there are disclosures anywhere. And I always say, consider my bias. Absolutely do consider my bias. Somebody's just flown me across the world to be here. Absolutely. Yeah. My words are my own. No one has read these before I publish them. And let me tell you, no company wants my words. They don't want to own them. They don't want to review them. They're like, my mind is pretty much like it is when we're talking. It's the way I write. I'm all over the shop.
And bias exists. There isn't a person who opens their mouth to say anything that doesn't come bias. It's inherent because it's, personal views and personal opinions.
Yep. Absolutely. But I equally believe that, sorry, go on. I was just going to say, and I am one voice. My voice is no better or worse or more legitimate than anybody else's, and my opinions are no more valid than anybody else's. So my advice is always listen to as many people with diabetes as you possibly can. If you're a person with diabetes and you're wanting an idea about, hey, how does that pump feel if I'm using it, read as many whether it be any sort of comments from people with diabetes who are using it, to see what they say, because that's how you actually get a good idea of how it works in the real world, not on the shiny brochure that device companies put out where everyone looks just so happy to have diabetes. I don't know why, they all look so happy. But anyway, there we go.
So I want to sort of jump into some of the global picture in diabetes and understand your perspective on that. But before we do that, just to finish off on the Diabetes Australia thing. So what are the priorities at the moment, and what's happening right now with Diabetes Australia, and what are your priorities?
Look, I think it's really interesting because people seem to think, okay, let's go back a step. All health organisations worth anything are very much evidence-based. We have to be. We absolutely have to be. Now, that doesn't mean, though, that we will say that anything that doesn't have that evidence base should just be ignored. So I'm going to give you an example, because I think this actually gives you the idea of what our priorities are overall. So 2 years ago now, Diabetes Australia launched a position statement on DIY technology. So do it yourself, user-led, user-built technologies, okay? We were the first diabetes organisation to do this around the world. Now, which is, something that I feel enormous pride when it comes to, being totally ahead of the curve here.
Mm-hmm.
And diabetes says, we're not endorsing this. We're not saying get out there and go and build yourself one of these systems. But what we are saying is that if a person with diabetes wants to do this, and has chosen to do this, that they need to be supported in their diabetes care to do that. And that's kind of where we are when it comes to pretty much anything to do with the management stuff of diabetes, is that the idea that health professionals get to choose and rule and decide, that's not what we stand for. We work very, there's my dog.
Sorry. Is he Schnauzer?
Yeah,
what is it?
That's Sooty. She's very little, so she does look a bit like a rat, but she is a dog. So it's, can you see? Because no one needs to see.
What is she?
There we go. She's a mini miniature poodle crossed with a Maltese, a moodle.
Yeah, I've got a schnoodle. They're quite similar. We should get them to play sometime.
Yeah.
Cute.
They're fun.
So
she's very cute. The other dog is curled up asleep somewhere else, so I think she's going to stay away there. So that idea of, very much the person with diabetes being, ahead of their agenda. And also, so that comes down to whether it be the food, the diet that we choose, the technology that we choose, the way that we choose to see healthcare, whether or not we choose to access peace, all of those things. People with diabetes need to be supported with what it is that they're choosing to do.
So back to the question though, what's the priority for Diabetes Australia right now?
I guess our priority always is to, lessen the burden of what diabetes.
Maybe another question to put it is, what are the actions? Like, what are the things that you're investing in terms of actions right now?
Yeah. So we've spent a lot of time this year talking about mental health and raising awareness.
When you say talking about it, like what does that look like?
Yeah, so our national diabetes campaign this year was called Heads Up. So we do campaigns in different ways. So sometimes they're very much a community campaign, which is what Heads Up was about, raising the awareness in the general community about diabetes, not just being about numbers, about it also being a mental health, there being mental health implications, and really encouraging people with diabetes to seek support around that. But with that, a very clear action plan, I guess, for how people can do that. But then last week we ran a campaign called Get Your Socks Off, which is something that again, all of this is available on our website and on our socials. Go and have a look. Your Socks Off is something that we do very close. Like we work with different MPs and we let them know, who in their local areas has what are the numbers of what are the numbers of people with diabetes in their local area, and this is specifically around the importance of screening and monitoring for foot, for diabetes and diabetes related foot stuff. So that's that campaign. So we've got a campaign called Keep Site that, again, we spent a lot of time really campaigning to get funding to run a campaign that is it's a recall campaign and a reminder campaign, so people remember when they need to go and have an eye check. And this is, I always kind of feel like you hear a lot of people say that diabetes is like having a second job. And I've always said, I wish I had a PA who could do all the admin stuff to do with diabetes. My appointments remind me when, I can never, have I had my screening? I don't know. So this, I love Keep Site because it takes 2 minutes to register, and then you will actually get a reminder when it's time to actually go and do that, and a follow up from that as well. So, I guess it does come down to a lot of different things where we're trying to lessen that burden for individuals. So things like Keep Site and things like, reminding and helping people understand how to access mental health care if they need it. But then it's also a lot of working closely with government around, how do we put in place those structures, I guess, that can actually implement those lessening burden sort of things.
And I imagine that there's a competition for resources, right? So there's finite health dollars in the country, and there are an infinite number of, well, it's probably not an infinite, but there's no shortage of causes, be it diabetes, be it breast cancer, be it men's health, whatever you want to talk about. And everyone's scrambling to be heard and to get their piece of the pie. And so I guess that's part of what you're doing as well, right? You're advocating and you're fighting for money to promote the diabetes cause and the diabetes patient.
So let's talk about how hard it is to elevate diabetes when you are in a space where there are things like breast cancer and childhood cancers and things like that. Now, I am at no point here, and I'm going to be really clear about this up front, saying that anyone is more worthy or that diabetes is more worthy. But what I will say is let's talk about diabetes in terms of the stigma associated with it. Because we know that because of the way that we have spoken about diabetes for years and years and years, people think you brought it on yourself, get off your ass and go for a walk. Probably shouldn't swear on this, should I? Get off your backside.
No, swear away.
Go for it, put down the hamburger and you made this happen yourself. Unlike women who get breast cancer. Now, the thing that's really interesting is, one, yes, we know there are different types of diabetes, so that blame and stigma is far more associated with and connected, like type 2 diabetes, the stigma associated with that is horrid. But the thing that's really interesting is that when you look at something like type 2 diabetes, there are modifiable and non-modifiable risk factors, okay? And the ones that people have grouped onto is like, get off your backside and go and do it, are those modifiable ones. So, maintaining a healthy weight, eating fresher foods, making sure that you're not sedentary, all of these sorts of things. The thing is, those modifiable risk factors for type 2 diabetes are the same as they are for certain cancers, including breast cancer. Now, you would never hear somebody say to a woman with breast cancer,
that's a great point.
You should have lost weight. Now, no one ever, of course, no one should say that. So I'm glad that doesn't happen there. But hey, why is it okay to do that to people with diabetes? Diabetes has got an image problem, and that's a big part of what Diabetes Australia is trying to do. And we're paying.
Great. That's really good. I think that's important, actually. And I think I was one of those people that probably had an attitude towards type 2. And I used to want to distance myself from type 2 because I'd say, well, it's more of a lifestyle condition. And I think that that's a really great way to put it, actually, like the modifiable versus non-modifiable. I mean, we probably could say that type 1s probably have less modifiable than type 2, but it doesn't change the fact that there's actually a lot more non-modifiable elements to type 2. So you can have two people identically eating the same amount of food or having the same lifestyle, and one will get type 2 and one won't. And I think that's growing, right? And there's a massive amount of genetic component and so forth to that. And so I think that that's a really, I feel bad that I had an attitude that was wrong. And actually I think it's great to start to correct that, because I feel for type 2s who have that bias against them.
Yeah, and so a couple of points in there that are really interesting. I mean, that same thing that you just said about there being two people who eat the same and they will weigh the same, but one will get type 2 and one won't. That's just exactly the same as when you look at all people with diabetes, and when it comes to diabetes complications. We know, of course, that there are certain things that we can do to reduce that risk. But why is it that some people, who have behaved in exactly the same way, had the same A1C, all of the same thing, but one person gets gets complications and another person doesn't? So there's the same thing so the conversation around complications is actually probably where we can talk about that modifiable and non-modifiable, even in people with type 1. There may not be that modifiable factor when it comes to actually getting type 1, but actually there might be when it comes to getting complications. But again, no one, regardless of what type of diabetes they have, if they are diagnosed with a diabetes-related complication, they shouldn't be blamed for it, because all that does is it sends people underground about not seeking care, not talking about it, not knowing where to go because they're too afraid to ask someone, not hearing stories about people. And we know that hearing stories of others who are living with the same thing, that makes us feel less isolated, all of that sort of stuff. So
and it makes it harder to advocate. Well, it makes it harder to go and fight, as this is where we started, right? To fight the cause of getting the funding and the support that we need, because there's attitudes that are incorrect.
Absolutely. So when you ask about, priorities of Diabetes Australia, one of them very much is to really have people understand that all types of diabetes are really complex, very complex, that blaming people is not the way. Now, we've done that in a number of different ways. And one of the ways, I guess, that I'm probably most proud about and that I talk about so much is our language position statement. And we did this 9 years ago where we put out a statement that was, hey, the words that you're using when you're communicating about diabetes, they matter. They matter to the individual, because if I'm sitting there and I've got a health professional stigmatizing me and using judgmental language and telling me that I've failed, what are the chances of me really wanting to go back and do something again? But also more broadly, when we're talking about diabetes in the media, the way we've done that is really dehumanizing in a lot of ways. Like next time that there is an article about diabetes on the 6 o'clock news, look at the images that they use. They use headless people. They cut off people here, and they may be overweight, and they're sitting there eating a hamburger. You see they cease to exist as a person anymore. So we've done, and this is now a global movement. Language Matters is now a global movement that was started in our offices here in Australia. And until we really get that, and it's interesting because at the time people said this is just political correctness gone mad. Who cares? As long as people are getting the right care. It does matter, because it means people feel shame. We don't want people feeling shame. We don't want them feeling guilty. They don't seek medical care. We've spoken about that. They don't seek help. We've spoken about that. But it also translates to less research dollars. So if you look at NH and MRC grants every year, diabetes way down the list, even though there are so many people with diabetes.
And the reality is the ROI for $1 spent, and I'm not saying this with any kind of, this is just purely an opinion, but I could imagine, given the impact that diabetes has on the health dollar, from a long-term perspective, that if you can start to rectify and start to get things right really early in a preventative sense, that the long-term the long-term benefits to the health system are going to be significant for type 1 and for type 2. And I think that's got to be a great argument for the government. Like, spend money in this space, get it right, and you're going to have more money left over later on to go and spend on other things.
Yeah, absolutely. And the cynic in me, and this is very much the Renza cynic, I'm only ever speaking for myself, is, hey, if there's a saving 10, 15 years down the track, who in power right now really cares about that? Because they won't be there. So
and this is a whole other discussion. Look, I think we could be worse from a health system. I think we could be the US system, and it seems to be that this comes up in so many of my discussions lately, is like the US health system. But it is an example of getting it wrong in terms of like the inefficiencies and the outcomes. They just, they spend more than anyone, and they get, then the outcomes are not better. And it's so short-sighted because it's all profit-driven. I mean, we're lucky in the sense we're not quite there, thankfully, and hopefully we never get there. But there are some Northern European systems that do take that less capitalistic approach and do have more of a sense of like, let's invest in healthcare and let's get it right. And that's why you see, like, is it Sweden or one of the Scandinavian countries that have 80-something% of their type 1 diabetes on CGMs? And that's because of government investment, and that's nice to see examples of that type of system existing, and let's hope that we learn from it.
There are systems that we can hold up to say, hey, look, this works. And I think we are so lucky in Australia in so many ways, and we are the envy of a lot of places around the world because of the way that we work. We and the choices that we have. We have a great public system that is underfunded, but every single public system around the world is. But the diabetes care in our public systems generally is fabulous. But we also have a private system, people who can access it, whether it be that they can afford to access it. If they need in-hospital care, they've got private health insurance, all of these sorts of things. So we have choices, and I think choice is really critical. I really do believe that choice is important. But, and as somebody who has accessed both public and private, I can say that both, she is now 15, but all of my pre-pregnancy, pregnancy care, and the delivery of my daughter, well, not the delivery, but up to the delivery, was done in the public system. And that multidisciplinary team that I had there every single time I went to the doctor, and it was every 3 weeks I was going to diabetes and pregnancy clinic, was remarkable. It's absolutely the envy of the world. It costs me nothing. And at the point of care, obviously, I pay taxes. So, you know, and I think that's actually a really interesting point. Again, that's why language matters so much. Yeah. We think that because we don't pay for something when we're standing there and we've walked out, you know, whether we're seeing a bulk billing doctor or whatever, that it doesn't cost us anything. But it's just that it doesn't cost us anything there. Everything is taxpayer funded, so everything has a dollar value on it. But because we think of things as being free, we don't value them sometimes. And I think that, you know, we have a public system that is truly remarkable. It really is. And I know people have had crappy, you know, experiences. Of course they have. So I'm not minimising that. But I think that by and large, we really are very fortunate here in Australia.
It could be worse. And we are moving to more of a patient-centered, value-based healthcare system, which is good. And it's, you know, it's taking a while, but we are getting there. It sucks because I feel like we've just scratched the surface, but I'm going to wrap it up. And I think that what I'm going to say is like, you know, I'm thinking that this could be a part one of a couple of different chats, if you're open to it, because I really would like to I'd like to jump into a bit more around like the global perspective, because I think that, you know, I'm fascinated, and I don't want you to answer this now because we don't have time, but like I'm fascinated in things like, you know, the percentage of people in the world that have decent healthcare, the percentage that don't. And like, you know, I think raising awareness and getting people to realize in first world countries how lucky we are to have the care that we have, and how many people don't have it and what that means. I think all that stuff really interesting, and I think that there's many different directions we can go in, but we've run out of time for today. Sorry. So if you're happy to kind of maybe do this again some other time, that'd be great.
I would love to. You just invite me back and I will come and speak manically and wave my hands around and have a little dog over my shoulder again. Anytime.
It's so good, so good to chat. Is there anything that you want, any like key message or any comment you want to leave the listeners with today?
I guess seeing that we've been talking a little bit about, we have touched on the whole thing about the importance of being connected and people's stories and stuff like that. I would really encourage people who have not necessarily had a look at what that global diabetes space looks like is to delve into it. You know, Twitter, Facebook, Reddit, Instagram, anywhere, TikTok. It's so easily available. If you Google diabetes online community, I promise you will be launched into what you will. It's huge, it's massive, and it might take you time to find your corner of it. But honestly, I always say that my peers with diabetes are just as important to me as every other part of my diabetes management. And if you don't have that and you're feeling up to it and you're feeling interested in it, try and go and find it.
Thank you so much for your time. I look forward to chatting again. Have an awesome day and have a great weekend, and I'll speak to you soon.
Sounds great. Thank you.
Renza. Take care.